Time is 6:43 on Sunday the 5th of July 2020 and I'm recording from my iPhone screen. I've gone to the website of health.vic.gov.au and going to the information about coronavirus. I'll start off with the latest Victorian numbers here. There are those. Now I'll go to the bottom to the media release. It's the media release for 4th of July. Coronavirus update for Victoria, 4 July 2020. The total number of coronavirus Covid-19 cases in Victoria is 2,469, with 108 new cases reported yesterday. The overall total has increased by 101, with 7 cases reclassified. Within Victoria, 14 new cases are linked to outbreaks, 25 new cases have been identified through routine testing, and 69 cases are under investigation. No new cases have been detected in return travellers in hotel quarantine. There have been no new deaths reported. To date, 20 people have died from coronavirus in Victoria. There have been 389 confirmed cases of coronavirus in Victoria that have been acquired through unknown transmission. There are currently 509 active cases in Victoria. Currently 25 people with coronavirus infection are in hospital, including 3 patients in intensive care. 1,938 people have recovered from the virus. Of the total 2,469 cases, there have been 2,119 in metropolitan Melbourne and 256 in regional Victoria. The total number of cases is made up of 1,304 men and 1,163 women. More than 906,500 tests have been processed to date. Of the new cases which have already been linked to outbreaks, the breakdown is as follows. New cases linked to existing outbreaks. 3 new cases are linked to Al Talqa College, bringing the total to 33. All staff and students have been quarantined and will be tested. 2 new cases are linked to the Roxburgh Park family outbreak, taking the total to 28. 2 new cases are linked to the Stanford Plaza outbreak, while 4 existing cases have been retrospectively linked, taking the total number in the outbreak to 40. 1 new case is linked to a Deer Park gathering, taking the total number linked to the outbreak to 12. 1 new case relates to the North Melbourne public housing apartments outbreak, taking the total to 11 cases. Contact tracing, testing and deep cleaning is underway. The apartments outbreak squad has already visited the site. 2 new cases are linked to the Woollet outbreak, taking the total to 17. New cases linked to freshly established outbreaks. 2 new cases at the Optus head office, taking the total to 5 cases. A deep clean has been undertaken and investigation into potential transmission occurring via social settings outside of work is ongoing. 1 new case at the Ascot Vale Primary School, a known close contact of an existing case, taking the total cases to 2. Other new cases of note. The department has been notified of a case in a contracted healthcare worker undertaking duties at the Park Royal Hotel. The person is believed to have worked shifts while infectious. The source of acquisition is currently unknown and all avenues of transmission will be investigated. The contact tracing process is underway, with all appropriate public health actions being implemented, including cleaning, quarantine and testing. A single case in a teacher at Debney Meadows Primary School. The acquisition source is being investigated. The school is closed and all close contacts will be tested. The department has also been notified of 3 new cases linked to healthcare workers in the emergency department at Northern Hospital, Epping. The source of acquisition is currently unknown and all avenues of transmission will be investigated. These cases were only recently notified to the department and as such are not reflected in today's numbers. The emergency department is still open but operating at reduced capacity. 2 cases have also been notified to the department recently in vendors from Preston Market. While it is not thought that any customers have been exposed, this is a timely reminder to Victorians to maintain physical distance while in retail and shopping environments. A new outbreak has also been identified at the Flemington Public Housing Apartments, with 12 cases now linked to the site. This includes 9 residents and 3 extended family members from a separate household, with cases being notified and linked together by the department in recent days. A daily clean of all the directly affected floors at both estates has been put into place, and on-site testing began on Friday and will continue over the next few days. With 2 separate outbreaks in public housing towers, the Victorian Government has announced new measures to slow the spread of the virus amongst these communities. Effective immediately, the 9 towers involved will be closed and residents will be required to stay in their homes at all times. This will be in place for at least 5 days to ensure we can test every single resident. The lifting of this restriction will be determined by our success in testing and tracking this virus. On the advice of our health experts, the number of hot zone postcodes will also be expanded to include 3031 and 3051. This will be effective from 11:59 p.m. tonight. This is in addition to previously announced restricted postcodes 3012, 3021, 3032, 3038, 3042, 3046, 3047, 3055, 3060 and 3064. These postcodes must follow the stay-at-home directions until 29 July 2020. People who live in these restricted postcodes are only allowed to go out for 4 reasons: shopping for food and supplies, medical care and caregiving, including to be tested for Covid-19, exercise, and study or work if unable to work or study from home. For people living outside these restricted postcodes, there are only 4 reasons to go into those postcodes: shopping for food and supplies, care and caregiving, exercise, and study or work. People who live in these postcodes cannot have visitors to their home or visit other homes except for caregiving or compassionate reasons or receiving services. Businesses and facilities in these postcodes that have reopened will again be restricted. Cafes and restaurants will only be able to open for takeaway and delivery services. Quote, Victorians in these lockdown suburbs are being urged to do their bit in the fight against coronavirus. Stick to the rules and get to a testing station, unquote, Victoria's Chief Health Officer, Professor Brett Sutton said. Quote, this virus is not selective. It will impact anyone it encounters, and personal contact is the clear source of its transmission. More than 300,000 people live across these suburbs. We need everyone to do their part and to ensure it is stopped in its tracks. There is no excuse for not getting tested. We have people knocking on your door, coming to your neighbourhood. We are bringing the testing to you. There are also several drive-through and fixed sites where people can go. And no matter where you live, it remains critical to practice good hygiene in and outside the home. Wash your hands regularly, cough and sneeze into a tissue or your elbow, and try to avoid touching your face. Stay 1.5 metres away from anyone you don't live with, and avoid crowds, especially indoors. If you can keep working from home, you must keep working from home. Don't take this disease lightly. If you feel unwell with any symptoms of coronavirus, however mild, you should stay home and get tested. If you have any fever, chills, cough, sore throat, shortness of breath, runny nose, and loss of sense of smell or taste, stay home. Don't go to work, and don't visit friends and family. Get tested and stay at home until you get the result. End of quote. I'll now go to the top part here where you've got the announcements, public housing lockdowns, statement from the Premier. Today's numbers represent the Today's numbers represent the second biggest increase in confirmed cases since this began, and the biggest jump since 28 March. As these figures show, we're still on a knife's edge. Rather than spread across the state, we know many of these cases are located in specific communities. That means the need for targeted, swift action is stronger than ever before. In recent days, 23 cases across more than 12 households have been identified in the Flemington and North Melbourne public housing estates. This represents a challenge we've not yet encountered. This is not like an outbreak spread across multiple homes or multiple suburbs. The close confines and the shared community spaces within these large apartment blocks means this virus can spread like wildfire. And just like fire, we need to put a perimeter around it to stop it from spreading. It's why effective immediately, these estates, encompassing 9 sites, will be closed and contained. Residents will be required to stay inside their homes. Just as we've done with similar outbreaks in closely confined settings, like aged care, the only people coming in and out will be those providing essential services. This will be in place for at least the next 5 days, ensuring we can test every single resident. The lifting of this restriction will be determined by our success in testing and tracking this virus. Operation Benessere will be supported by on-site police and PSOs, ensuring safety, compliance and security. Residents will be supported with on-site clinical care, as well as food delivery and care packages. I know this is big. I know this is unprecedented. But as always with this thing, an unprecedented challenge requires unprecedented action. On the advice of our health experts, the number of hot zone postcodes will also be expanded to include 3031 and 3051. This will be effective from 11:59 p.m. tonight. For residents in these postcodes, the message is clear: stay at home. There's only 4 reasons to be out: again, shopping for food and essential items, care and caregiving, exercise, work and study if you can't do it from home. These postcodes are experiencing elevated community transmission, and the only way to combat that is with stronger restrictions. But it's not just enough to impose them. We need people to abide by them, to follow the rules, to listen to the advice, to think not only about themselves but their families and friends and communities. This virus is dangerous, it's indiscriminate, and it has the potential to undo everything that's been achieved. I understand people are tired, they're frustrated too, but just as we drove down this virus before, we must do it again. We need Victorians, your collective commitment and courage, because we all have a part to play. It's up to all of us to make this work. Next I'll go to the restricted postcode section, and here I'm going to read the religion and ceremony section. Key points from 11:59 p.m. 1 July. If you live in a restricted postcode, you cannot attend a religious service. Online streaming of a service is allowed. Weddings in restricted postcodes can have a maximum of 5 people, the couple, 2 witnesses and the celebrant. You can travel to a wedding outside a restricted postcode. The restrictions apply based on the location of the wedding. Funerals held in restricted postcodes will be restricted to 10 mourners, plus people required to conduct the funeral. You can travel to a funeral outside a restricted postcode. The restrictions apply based on the location of the funeral. Next part I'm going to go to is from the Chief Medical Officer's briefing for the Chief Health Officer daily update for 3 July. There's a point I want to emphasise here about tests. Okay, so we've got these special suburbs where people can be tested. Residents of these suburbs and in the restricted postcodes will receive free testing with or without symptoms. People getting tested in hotspots who are asymptomatic and awaiting test results do not need to self-isolate. In line with existing guidance, if people feel unwell or have any of the coronavirus symptoms, they should self-isolate. I'll finish it there.